My name is Andy Tatem. I'm a professor at the University of Southampton. I direct the WorldPop group in the School of Geography and Environmental Science. So when the coronavirus outbreak first occurred, we realized that we had skills, expertise, data sets that could be of value in trying to firstly understand what was happening, map out the distributions and the spread routes of the disease, and then also the skills to be able to understand the best ways to tackle the disease, to learn lessons, and to try and mitigate the spread. We also have worked for many years in utilizing aggregated and anonymized mobile phone data. And these kind of data can be useful in terms of trying to tell us how populations are moving around countries. And it's the population movements that as the driver of many infectious disease spreads. So what we're seeing in the coronavirus outbreak is the big movements that we all make nowadays. Populations are more connected than ever before. That can help us understand how a disease is spreading and be able to predict where it's likely to go next, and what kinds of interventions can be most important and effective in controlling the disease. We also worked to develop a model of how that disease was spread throughout China. So we were able to take the mobility data that we had from movements of phones. We were able to look at case data and some of the early estimates of how the disease spread, to build a model of that spread within China. And once we had a model that was seemingly replicating the data that were coming from China, we could then look at that model and identify, okay, what would have happened if there had been no interventions at all? Or what if we'd happened if we'd just taken a certain type of intervention? What we found was quite striking. If no interventions were put in place at all, we perhaps would have seen an outbreak in China around 70 times bigger in February than actually occurred. If interventions were put in place a week earlier or a week later, major impacts would have occurred. The massive interventions that were put in place in terms of locking down entire cities actually had a major impact. From there, we were able to draw lessons that the rest of the world is now looking at and learning from. So I think some of the lessons that we can draw and that many others are drawing from our research are that interventions put in place as early as possible can be the most effective. Not only put in place as early as possible, but identifying and isolating cases as early as possible is vitally important. So I think this disease is going to change society in many ways. It's making us all wake up and realize how much of a global community we are now, and the importance of hopefully working together as a global community. These diseases don't respect national borders, as we've seen. Nearly every single country in the world has cases already. And it's only by working together in terms of sharing information, in terms of learning from each other, and in terms of collaborating on interventions that we're really going to be able to tackle things like this in the future. So when we come out of the other side of this pandemic, in terms of what society will look like, it's a difficult thing to predict. I'm hoping there's some positive things that can come out of this. We can realize the value that so much of the key workers across our society play to keep things going. I'm hoping that we can also build on all the science that's being undertaken. There's a huge amount of work that's been undertaken in just the last few weeks, and we can remember this and build on it and invest in preparations so that inevitably when something like this happens again in the coming years, decades, that we are much better prepared as a world.